Hello, my name is Vivian Vu, and I'll be teaching you today about cystic fibrosis. As you can see from the image on the screen, cystic fibrosis is commonly thought to be a disease causing mucus in the lungs. In actuality, cystic fibrosis affects more than just the lungs. It affects many organs like the digestive system and reproductive system. Cystic fibrosis is an autosomal recessive genetic disorder on the chromosome number 7. An offspring with cystic fibrosis will inherit two mutated alleles coding for a cystic fibrosis transmembrane conductance regulator protein, also known as the CFTR protein, that helps regulate the movement of salt and water in and out of the cell. With dysfunction in this protein, thick and sticky mucus builds up in the lungs, pancreas, livers, and reproductive organs, resulting in the symptoms that you see cystic fibrosis patients having today. There are about 40,000 people in the US that has cystic fibrosis, and around 105,000 people in the world have this disorder. The incidence of new cases diagnosed with cystic fibrosis is around 1,000 in the US annually. Caucasians tend to have a higher rate of cystic fibrosis, even though it affects people of all ages and races. This can be explained by gene pooling because the condition is passed down. 1 in 30 people are carriers for cystic fibrosis, but not all of them are affected by this disorder. Cystic fibrosis is a life-shortening disease. In early times, those with cystic fibrosis would often die in childhood, but with modern medicine and better understanding of the disorder, the life expectancy has greatly increased to around 40 to 50 years old. Cystic fibrosis is caused by a mutation in the CFTR gene, which codes for a chloride ion channel. The CFTR protein is activated by protein kinase A, which phosphorylates the protein to open and transport chloride out of the cell. In less obvious amounts, the protein also transports bicarbonate ions out of the cell. As chloride ions are pulled out of the cell, the chemical gradient pulls sodium ions out of the cell as well to balance out the negative charge from the chloride ion. Water follows sodium out of the cell due to the greater osmotic pressure. Typically, this helps hydrate the outside and thins out the fluid. Additionally, the bicarbonate ions help to neutralize the acidic environment to prevent the digestive enzymes from denaturing. In cystic fibrosis, however, the channel function is significantly decreased, which causes the chloride ions to remain in the cell, and the sodium follows as well, using the epithelial sodium channels, also known as ENaC, and water remains in the cell. This dehydrates the fluid outside, making it become thick and sticky. Because bicarbonate ions are also higher inside the cell, the bicarbonate cannot neutralize the acidic environment, causing the digestive enzymes to denature, and then this causes malnutrition as seen in cystic fibrosis patients. This channel works in the opposite direction in the sweat glands, however. The channel brings ions into the cell, drawing water in, but in the case of cystic fibrosis, the dysfunction in the protein causes a buildup of the ions outside of the cell that cannot be transported in, resulting in the salty skin that a lot of people recognize, and a lot of people use it to test for cystic fibrosis. There are over 2,000 different mutations, which are categorized into 5 different categories based on how the CFTR protein function is mutated. The first class is the protein production mutation, resulting in from a nonsense or frameshift mutation that prematurely stops the coding of the protein. So in this case, no protein is made. In the second class is the protein processing mutation that causes a misfolding of the protein. This can be caused from a missense mutation. The F508 is the most common mutation, affecting about 70% of cystic fibrosis, and this falls into the second class. Class number 3 is a gating mutation, which means that the CFTR protein is able to be produced, but then it fails to open, so then there's no movement of ions. Class number 4 is similar to class number 3. The protein is produced, but then there is a flow, but it just works really slowly, so this causes a reduce in conductance. And then the final class is characterized by the reduction of the CFTR protein levels. So then the proteins are being made, it's just that there's not a lot of them being made, causing ion flow to decrease. Signs are observed or measurable evidence of the disease, while symptoms are subjective experience of the disease. Some of these have already been mentioned, but some of the signs of cystic fibrosis is salty skin, frequent lung infections, abnormal chest scan, malnutrition, and fatty stool. The frequent lung infection can be seen because mucus is thick and sticky, which traps the pathogens, which gives them a greater opportunity to infect the patient with cystic fibrosis because the mucus is hard to remove. Malnutrition happens because the ducts are being clogged, which prevents the digestive enzymes from reaching the intestines. Additionally, with cystic fibrosis, the environment is more acidic, which denatures the digestive enzymes, which prevents them from digesting the food and then absorbing the nutrition. Some of the symptoms that cystic fibrosis patients have and experience include wheezing, shortness of breath, persistent cough, fatigue, and abdominal pain. As mentioned before, the cause of cystic fibrosis is the inheritance of a mutated CFTR gene from both parents. There are over 2,000 mutations found that can contribute to the gene. Because the disease is genetic, the risk factor is having two parents that are carriers for cystic fibrosis. Cystic fibrosis has many factors that can worsen the symptom of the disorder, which includes having poor nutrition, lack of activity, smoking, and weak lungs. Preventative measures for cystic fibrosis involve genetic testing. This involves genetic testing of the parents to determine the probability it will be that their offspring will have the disorder. But then other preventive measures that involve more of managing the symptoms once people have cystic fibrosis involves things like respiratory therapy, which can help those with cystic fibrosis increase the amount of oxygen they inhale naturally. This is done by teaching them optimal breathing techniques. Additionally, they can get caught up with their vaccinations, and this can help prevent them from having infections because cystic fibrosis patients tend to be more prone to infection. Additionally, by avoiding smoking, this can subdue symptoms that are involved with the lungs, and then nutritional support can help balance out the symptoms of malnutrition. CFTR modulators are drugs that increase the function of the CFTR protein. Because there are many different forms of the mutation, certain modulators are specific for certain mutations. So genetic testing is done to determine if the patient is even eligible for the drug. There are two types of modulators, potentiators and correctors. Potentiators bind to the channel and force them open. They work best with class 3 gating mutations because they force the protein that is closed to stay open. And then they also work well with class 4 mutations, which are proteins that have a slow conductance. So by binding to it, they force it open, which allows faster movement of the ions across the channel. Kalidecto, also known as ivacaftor, is an example of a potentiator that is used for patients that are 4 months old or older. Correctors are the other type of modulators. They help proteins fold correctly, so they work well on class 2 mutations. However, the function isn't optimal, so then they're often paired with potentiators. An example is Trikafta. This is a triple combination modulator which are recommended for patients 2 years old and older. They combine two correctors, elexacaftor and then tezacaftor, and then the potentiator is ivacaftor. Cystic fibrosis treatment often focuses on managing symptoms of the disorder. To help with breathing, bronchodilators can be used to help open up the airways in the bronchioles. To help loosen up the mucus in the chest, physical therapy can be done by applying chest slaps to the chest and then draining it. And then similarly, a therapy vest can be put on to help vibrate the chest and then loosen up the mucus. Cystic fibrosis is often diagnosed through a series of tests. Newborn screening is done on the infant's blood to check for the level of immunoreactive trypsinogen, also known as IRT, a protein produced by the pancreas. Elevated levels of IRT can be a symptom of cystic fibrosis because the mucus blocked up the ducts, which prevent the release of the enzyme, so then the enzyme gets overproduced. However, high levels of IRT alone is not conclusive of cystic fibrosis because other conditions can also contribute to the elevated levels of IRT. A golden standard for diagnosing cystic fibrosis is the sweat test, which involves testing the chloride concentration of the patient's blood by using electrodes that deliver an electrical current. Results with 60 millimoles per liter indicates a positive result for cystic fibrosis. Additionally, because cystic fibrosis is a genetic disorder, genetic testing can also be done to determine if the patient's genome consists of the mutations that contribute to cystic fibrosis. Genetic testing also plays an important role in treatment as well because certain drugs work better for some mutations than others. Genetic testing should be done to determine which route is best for the patient. Overall, cystic fibrosis is a complex disorder that is important to diagnose young to help with management of the disorder, which is why many different tests are available even as early as the day that you're born. And this concludes the end of the presentation, and here are the sources I used. Thank you for listening.